I have a history of spina bifida. I didn't tell anyone, and I didn't ask for anything because I didn't think I had any rights to, and I didn't think that I needed it. And now I see how horrifying and frightening that was. Thank God I didn't hurt myself. Certainly not in the era that I came through on. The culture of medicine historically has been one that you have to be superhuman to get through it. In the era I came through, we didn't have hour restrictions. You went to work at 6 o'clock in the morning one day and worked until 6 o'clock the next day in the evening. If you didn't or couldn't, then there was something wrong with you, not the system. My advocacy was slow to emerge and only when forced. I didn't do it without having to be pushed at every step, including when I moved back to the US only 3 or 4 years ago. It is not something that, certainly not in my generation, we were taught to do or that we thought to do.
Welcome, everyone. Today, I am honored to interview Dr. Church, who is a graduate of the University of Vermont College of Medicine. Her pediatrics training was completed at the University of Chicago, UIC, focusing on inner city medicine and complex care. She then completed a combined fellowship in neonatal perinatal medicine and developmental behavioral pediatrics at Tufts University School of Medicine in Boston. She's board certified through the American Board of Pediatrics in both neonatal and perinatal medicine and developmental behavioral pediatrics. Dr. Church is on the staff at Beth Israel Beaconess Medical Center as a neonatologist and a developmental behavioral pediatrician, and is the director of the Growth and Developmental Support Program Clinic at Boston Children's University. Her academic interests include developmental care, long-term outcomes of babies who were cared for in the NICU, systems of care, spina bifida, and disabilities. Welcome, Dr. Church. I would love to hear a little bit more about your individual journey and background.
Sure. My background is I went to the University of Vermont College of Medicine, and my interest in medicine started very early in my childhood when I was repeatedly in the hospital for surgeries because I have a history of spina bifida. I remember not being thrilled with all of the healthcare I was receiving, and my mom saying, if you want to make a change, maybe you should go and be a doctor, and then you can change it from within. That was when I decided to be a physician very early, not even high school.
Was there anyone else in your family in the medical field?
Yes, I come from a family of physicians. As much as that offered some protection and assistance navigating the healthcare system, in other ways, it was just like everybody else and not any more protected than anybody else in the healthcare system. But it definitely provided some guidance for sure.
Okay. Since a young girl, you were very interested in going to the medical path. What happened then?
There were some moments of lack of success, which are good teaching moments. I decided to go into nursing school, partly because my father, who's a physician, was very worried about the physical demands of medicine and the lack of support to accommodate physical needs. He thought the nursing field was further advanced in that, which I think he was probably right. But it wasn't the right fit. It wasn't really where my heart was. And I didn't do very well academically in my nursing classes. I withdrew, spent some time reevaluating, and then pulled down and went to medical school.
Wow, that is a very unique journey. Not a lot of people have said going to a nursing path. Was your dad correct of his concerns with physical demands and accommodations?
Yeah, I think he was spot on. I think he saw the writing on the wall. As a physician, he could see it. That being said, I wasn't willing to hear that, and I wasn't willing to accept that. I just made choices to accommodate myself in ways that were really maladaptive and unhealthy, but at the time were all I had and seemed very wise.
Now, I know from your previous podcast episode at Docs with Disabilities and the article that you've written before, you've mentioned that you did not disclose your disability and kept it for yourself for a long time. Can you speak a little bit about that?
My form of spina bifida is a closed neural tube defect. While there are scars, they weren't obvious. I am ambulatory with a lot of exercise and work to stay ambulatory. Outwardly, I could conceal the fact that there were any active issues. I'd say the more difficult things to navigate were the neurogenic bladder and bowel that were associated with the disability. And that was definitely something that was much more active in medical school. How I dealt with it was I just didn't drink or eat because that made so much sense at the time. I would go sometimes a day, sometimes if I was on call, a day and a night where I would barely eat. I'd snack. I'm sure people thought I had eating disorders and all these things that were maladaptive, but the drive for it wasn't necessarily for how I looked. The drive for it was to control a condition that I didn't have complete control over, and one that I wasn't getting any accommodations or support for.
Wow, that is impressive. I like how you mentioned you tried to take care of yourself to control something that you really couldn't control.
Absolutely. I have a really nice dental bill from all the candy I ate because that was something I could do. I could have sugar, blood sugar could stay up if I just put like something in my cheek to suck on. I didn't realize what I was doing to my teeth. I just wasn't willing to worry about it at that moment.
So then, was there any decision when you made your residency decision with your own body and how your own health would be impacted?
I was incredibly lucky. I chose an incredible program. I went for one where I really felt comfortable. It just seemed like a nice group of people that were going to be supportive. And when I did have to have surgery during residency and it became more clear that there were more medical issues, the program was amazing. Following that gut instinct about the quality of the people was enough to protect me. I worked hard, I earned a good reputation, but the people I worked with were incredible, kind, and supportive. So I got fairly lucky on that.
I'm so glad to hear that because I think a lot of students, that is their fear, and my own, and that's something I'm looking for, to find a residency that is supportive. When you did have to go to those surgeries, did you disclose the reason why you were having the surgery?
To some degree, yes. I had the surgery at the same hospital where I worked. This was quite a while ago. I went home for a visit with my parents, and I had deteriorated physically to such a degree that my father actually called the head of the program and said, "What happened to my daughter? She went to your program. She was ambulatory. She was doing well. She's barely walking on uneven surfaces. She's got a high guard gait." My father could diagnose it. It put the program on notice that someone with experience was watching them. I was furious that he did it. I had no idea he had done it. And I was summoned to the head of the program's office and told that I needed to get medical care and couldn't ignore it. That set off the cascade of having to have the surgery. But I don't think that happens anymore. I don't think a parent can call a program and complain. That is definitely the olden days and so paternalistic, but it was the right thing to do. I needed help, and my father was smart to identify that.
It sounds like he had the best interest to support you, but that would be a little odd if I was a program director and randomly had a
Yes.
call from a parent of an adult.
Can you imagine? Exactly. On every level, it was like, what did you do? He knew me better than anyone, and he knew I wasn't going to do anything to take care of myself.
Yeah, that does sound like it was the fact that he was able to advocate for you. Did that kind of advocacy, being able to self advocate for your needs, did that change over your career?
Yeah, I think at that stage, and I think that's a really good, important question. At that stage in my career, I did not have any self advocacy skills. I was falling down the stairs at work and not telling anyone. In those days, you had white coats and you'd have all your little pens lined up and they'd be all perfect. And then I'd fall down the stairs, they'd be in the wrong order. And my Harriet Lane was no longer where I thought it was. I didn't tell anyone and I didn't ask for anything because I didn't think I had any rights to, and I didn't think that I needed it. And now I see how horrifying and frightening that was. Thank God I didn't hurt myself. Certainly not in the era that I came through on. My advocacy was slow to emerge and only when forced. I didn't do it without having to be pushed at every step, including when I moved back to the US only 3 or 4 years ago. It is not something that, certainly not in my generation, we were taught to do or that we thought to do.
That's a good point. I really liked how you said you didn't feel like you had the right to ask. I can associate with that sentiment, especially in that time period. I'm wondering if being a female in medicine early on had any impact, or was it just the culture of medicine itself that kind of, you weren't allowed to be an individual or be a human?
Culture of medicine historically has been one that has been fairly, you have to be superhuman to get through it. In the era I came through, we didn't have hour restrictions. You went to work at 6 o'clock in the morning one day and worked until 6 o'clock the next day in the evening. If you didn't or couldn't, then there was something wrong with you, not the system. When you put it in the context of that environment and think of trying to advocate within that, it wasn't an environment that lended itself to encouraging that. I'm not saying that was right. I think in many ways it has changed. It needed to change. I do think patient care, there was a lot of learning opportunities that came from that. And I don't think physicians are something that you turn off at 5 o'clock. I just don't believe that. I think there are different ways to teach that fact. In terms of self-advocacy, like there weren't people like me talking. We didn't exist. And now that I've met other women mostly who have physical disabilities or other disabilities, it's been nice because there is this, and I don't want to say it's a sisterhood, although right now it feels like that because it feels like most of the people I'm meeting are women. It's created a strength that we didn't have in isolation. Not that long ago, I was contacted by a resident in a state not mine. And the resident was clearly having a hard time and not getting what I thought were appropriate accommodations for her physical needs. And being new back to the US, not knowing the exact rules, I reached out to different friends in leadership positions at different hospitals, was given direction, and I encouraged the resident to go in that direction. But it was clear that it still wasn't working. It was really only when I reached out to a colleague and a friend of mine now, Amy Rule, who has also spoken a lot about disabilities, and she is a physician with a disability, and she just wrote a beautiful editorial in Pediatrics. It was when the two of us started to make it clear that we were paying attention to this resident's treatment that the program started to change. When there became more numbers scrutinizing how the program was not meeting her needs, all of a sudden things got much better. And I also went to the Spina Bifida Association. Clearly, the numbers do have a voice that the individuals don't.
Yeah, that is the case. But I'm so glad that you've been able to find, like you said, a sisterhood. I was just talking to another student about that. I'm so glad that there are all these role models. But what about for this particular individual that identifies as male, that hasn't had that opportunity to have a male role model with disabilities? I'd be interested to hear your thoughts on why you think it's mostly a sisterhood right now.
I think Lisa Meeks did an incredible job at pulling people together, having people offer their voices. Before her, we were all in our own little worlds trying to survive and not paying attention to anything or anyone else. I think mostly because the individuals I've met through Lisa have been female. It's just a path I've been on. I do know of one male individual who's now retired, but who has spina bifida and was also a role model to me, both professionally and personally. He was fantastic. I do think there is something to be said for having that mentorship, regardless of the gender or individuals ascribed gender. There is also something about, because there is a transsectionality of being a female and having a disability that is important as well, to find that opportunity to talk to each other. Parenting, being a mother, things like that that are unique to the female body. Now, I did not have my child. We adopted her, but there's still a lot of crossover in that experience.
Yes, I agree. I'm really glad you mentioned that word of transsectionality. It's something that I've been trying to incorporate a little bit more in addition, bringing in something like lower as social economic place, or individuals who are underrepresented in medicine, Latinas, Latinx and Black background. Adding all these intersectionalities really can have even more difficulty in medicine.
Yes, and the individuals that I have had reach out to me for help have generally come from a place of not feeling as safe as I did with my father as a physician. My father, that example I gave was an exceptional one of how far he stepped over the line, but the fact that he did kept everybody on notice. He didn't have a lot of lines when it came to me. For other individuals who don't have parents that are in the privileged position of being a physician and being able to pick up the phone and call another physician and bypass that. If you're a patient, press 1. If you're a provider, press straight through. Even though he was not a provider in pediatrics, he played that role and he took advantage of it to serve him. And in the era that we were growing up, it was needed and essential because there was no complex care, no care coordination. For those individuals who I've helped or have been asked to get involved with, they haven't had that person on their side. It is obvious, and it's distressing to see the way they have been treated without someone advocating for them.
Yes, I definitely resonate with that perspective for sure. Let's shift a little bit. You went into pediatrics in the NICU. How has your individual experience and unique experience as a patient impacted your work as a physician?
That's a good question. In the role of the NICU, one of the things I struggled with, even though I loved the medicine, was the act of doing consultations. for parents that were pregnant with a child who's going to have a disabling condition, or for a baby in the ICU who had on ultrasound or something based on their clinical course, there was questions about whether or not there would be any long-term effects from that. I really struggled with that to the point where I actively chose not to do research with probably one of the more successful staff physicians in our department when I was a fellow, because she was doing research on identifying prenatally disabling or genetic conditions. And I just couldn't wrap my brain around how I could resonate with that work and not feel threatened. So I think that was the biggest struggle. And I think that has been something I've really worked on, to come to a place where I feel like I can give that incredibly important family altering information without doing it in a way that lends itself to a medical ableist bias, which I think is incredibly prevalent in our culture. That's taken me years to get to a place of doing. Having had the experience I've had, where if you read my chart, it'll say she has a moderate to severe form of spina bifida, but yet I have a great life. I have a very happy life. It's hard for me to reconcile that medical term with how I see my day-to-day life. Sure, there are moments where I'm really not happy, but that's everybody's life, and everybody has something. I think it's more important to provide that information in a way that describes what the days may look like, the hassles and the things that might be easier, describe the resources available, the medical treatments that are available, and let families make a choice about whether or not that lifestyle is one that they can support based on their jobs and their lifestyle, and not have it be about me going in and saying, I have bad news. I have really important news. This news is going to change your family, and that's important for you to know. This is what life will look like with this news. The information can still be conveyed, and yet it doesn't convey it in a way that injects a medical bias. And so that's been, I think, a big part of my work. I wrote the guidelines for how to counsel an individual carrying a baby with spina bifida. And then now doing some work, we just published a paper looking at how language is used in the ICU when it's around disability and how that can affect a family. I think that's been one of my biggest interests.
That is amazing. I wrote that down, and I'll make sure to include any links to those information, because I think that is very pertinent, especially in medicine, like you're saying. And if you have yourself some sort of connection, whether yourself, your family member, some sort of emotional connection to a certain health condition, it's really hard to be placed with a patient or family member who has that same condition. I know I've been struggling a lot with that as just a medical student. So I would love to hear how you did the work, or any advice you have, because especially we chose to do medicine, and a lot of times that motivates our motivation to treat other individuals who have the same condition.
I think part of it was working. I had the luxury and the privilege of working in the spina bifida clinic in Ontario for almost 15 years. And I learned so much from they were my patients, but really it was my people. It was me. And they taught me as much as I provided care to them. I think that helped. And I think reading and learning and acknowledging that you can have a disability and it may not show. For a long time, I felt like I had no place speaking about disability because I didn't think that I counted as a disabled person because of the stereotypical perceptions of what that is. It was only when I had surgery maybe 10 years ago that the Canadian government, and I didn't ask for anything. I just had the surgery. But then several years later, I got audited by the Canadian government I'd claimed catheters on my tax return as a medical expense. And they pushed back and said that I was not provide proof or what was the reason for it. And I was like, who on God's green earth puts these through without a reason? But it provoked me in a way that I then went through the regulations with the Canadian Tax Authority and Canadian Revenue Association and realized that I actually was eligible to file as disabled. And with that came a tax benefit. I did it. And then I was like, okay, if by people who care about money, I'm officially disabled, then maybe I am. And it was that, and also not being able to get disability insurance. These little things that you never think about when you're young. When you have a career and your career relies on you to have some ability to do your job physically, and you can't get any protection if you can't, it makes you start to wake up. And so it was really those factors. As I started to wake up, I started to read more and educate myself more and learn more about the perspective of the disability community with prenatal testing and the perspective of the disabled community in terms of other aspects of how medicine treats and writes about them. Talking and learning from my colleagues has been a lot of the journey.
You brought up so many important things, and thank you so much. So reading and also just talking to patients, talking to the community, and seeing as much that it's not just your own perspective. It's there's so many more people. I'm interested, you mentioned not fitting in with the social concept of a disability
Yeah.
and having things externally like the disability insurance and filing for disability. You mentioned a little bit about it, but I would love to learn more because there isn't a lot of talk regarding disability insurance and whether some will have it or if your condition will prevent you from having it in a medicine context.
Yeah, it depends. I came from the era before Obamacare. When I chose fellowship, one of the factors of fellowship was what state could I get healthcare in with a pre-existing condition. That's a different era. I think that doesn't happen anymore. But certainly, if you're in private practice and you're buying disability insurance as an individual, if you have anything that's been a flag, they're going to say no. And that's a big deal. The way it was set up in Canada, even though we were part of a large hospital and running a huge ICU with lots of nurses, our practice was private. And so there was only 8 of us. And so we all individually got our own disability insurance, and it didn't work. Like, I couldn't get it. And that was a significant stressor. If you join a larger hospital, like now I'm at Harvard, and through that system, yes, I'm eligible for disability insurance because they're insuring hundreds of people. The individual risk of you isn't as scrutinized, but it's a variable, and it's a big variable. And it actually made me aware when I was practicing, if I was seeing a child who had mild cerebral palsy, very mild, and it was on that edge of how much of an impact was it going to have, there was clearly a brain injury and there was a discrepancy in how their motor skills were developing. I talked to the parents about making an informed choice. I said, the downside of identifying this is your child may not be eligible for disability insurance when they're older. If it's a mild case, do you want to be quiet about it? You're not going to be eligible for a lot of medical care with the diagnosis anyway. Is there any benefit to it? Even though it's technically the appropriate diagnosis, is it going to help you? Some parents said they didn't want it. I don't blame them because it's a hassle to not really get disability insurance. You don't realize it until you're older, and then all of a sudden you can't get it.
That's helpful to know. I know when going into residency, that's one of the options, and some have it, some don't. So it's just important to know that it's there for individuals and start doing their own research on it and what's eligible for them. But it's interesting that you mentioned the difference between private practice or having to get it yourself versus a larger institution providing it. I had never thought about that.
Yeah, at the Women with Disabilities panel, that was a theme that came up. A lot of individuals on that panel talked about the benefits of being in a larger academic setting. It gave them more flexibility to have their career evolve rather than if you're just in private practice and you're just on your own and you're expected to take care of yourself, that liberty to morph into something else isn't as clear.
Yeah, that is a helpful perspective. It's good to hear that. I've been interviewing individuals at different aspects. So it's good to hear someone who's been through both and has decided one way or the other. I'm interested now that you have been more forthcoming. What was the motivator to start disclosing?
I think fatigue. The lack of authenticity, it really wears on you over time. I was struggling because I was called out for how I was doing some of my consults by colleagues. They were saying things like questioning what sort of consultation did I do and why did I do it this way? There was a little bit of that. It was hard to advocate that I had done all this reading and learning and really come at it with a powerful position. It all really came to a head when I was asked to consult a family, much against my choice, that was carrying a set of twins, one of whom had the same lesion as I did, and they were requesting a late termination of the affected twin because they wanted the unaffected twin to go as close to term as possible. In the centers that I worked at, there had to be an ethics review of that. It happened over a holiday and there was no one around. So I ended up having to do it and having to disclose to colleagues who didn't know that I had a bias and that the bias was profound. I had to disclose to the parents. And then they still asked for me to do the consult. I did it, and they ended up finding a way to have the infant terminated. It just picked open something that had really been bubbling there. And it was from there that I started really reading and learning. I reached out to a colleague who I had met years before who was blind. I had tried to avoid her because I didn't really want to get into the disability space. I sent her an email and she sent me an email back, and it was so simple. I've been waiting to hear from you. And this was 8 years later, and I'd only met her for 5 minutes. Clearly, she saw even 8 years prior the struggle I was having. She knew eventually I would come around. And so, really talking to her was the beginnings of me exploring how I could use my voice to be more authentic. From that, I wrote this editorial and it got published, and that was the beginnings of it.
Yes, and I'll make sure to include that editorial because it was so impactful. And I think it'll help a lot of individuals that struggle with the same, do I disclose? Do I not disclose? How will this impact me? As we start to wrap up, do you have any final advice or pearls of wisdom for other individuals who are in the midst of their health profession journey with disabilities or health conditions?
I think the most important thing I can say is there's a place for us. I worked really hard, as everyone will and does, to become a doctor. But the voice I have as someone who has walked in the Johnny as well as in the hallway with the white coat, it's a more powerful voice because I understand what it's like. And I think it does make us better providers to really understand the healthcare system from the underbelly, the inside. The interesting thing is many of the people who are going to train you and you're going to run into are all going to experience it at some point because it's inevitable that we're all going to experience disability. It might be temporary, it might be more permanent, but I think that usually when those people do, they have this epiphany and they want to talk about it. I think there's a voice and a need for us. While it may not be clear what the path is or how the system will bend and accommodate us, and I don't think that we do have a clear window into how that will happen, it's important that it does. It's important that we have an opportunity to contribute because I think patients are much more engaged and interested in knowing that their providers are experiencing the healthcare system just like they are.
Yes, I love it. What beautiful word. That's why I've coined the new patient doctor because there's just so much we can bring. And I love what you said of just the voice is just powerful. And there's a need to share that voice. And I never thought about the fact that you've had that experience and have done all this reading and personal experience contributes to your doctor, to actually your work, and it's almost like you did an extra fellowship in this because that's your life. And then expertise, that's the word that I was thinking of. You now have an additional expertise in this, but it's hard to express that expertise without disclosing.
Absolutely.
That's where I've individually struggled of how do I express all this knowledge I have as a medical student.
I think it is lived experience that's really important. The hard balance and an important balance to find is to make sure that the stories we carry are our stories and we leave them with us, because that's the one thing I'm very mindful of, particularly when I was taking care of other children with spina bifida. While my experience with the condition might be this, their experience may not be the same. And it can't be about them helping me get better. It has to be about me using my experience to help them understand, or use my experience to understand how the healthcare system might present obstacles for them. But it can't be for them to try to make me feel more whole, because that's not my patient's job. And that boundary is really important.
Yes, I'm so glad. I think that's exactly what you said of the using it to help others, especially patients. How do you know where that personal line is for yourself? And I'm sure it's different in all experiences, but do you have any advice on how to manage that boundary or how you do it?
Many of my patients knew I had spina bifida and it was in the press. I did not discuss it in clinic. If it did come up, it was only after I had met them multiple times. And then it was on the lines of, our experiences are not the same. That being said, I do understand this experience that you're having with whatever the healthcare system was that wasn't working or whatever. But I tried to keep a very firm line. If there started to be questions about my own experience, I'd say that's not what we're discussing. What we're discussing today is where the evidence is. This is what my experience has told me in terms of being a physician. And this is what I think the choices are. I was very careful not to have it be about me. That being said, it was tiring, especially because that population knew, and I adore that. But it also gets tiring because I knew that I was carrying a huge amount of responsibility. I understand it. My mom was the same way. My mom desperately wanted to meet people with spina bifida so she could understand what to expect for me and what to think about. And so I understand why these parents were so keen on meeting me and having me take care of their children. But it also came with a tremendous emotional burden for myself that I felt very responsible.
Thank you for sharing that emotional burden and vulnerability that needs to be mentioned because it's part of the responsibility, right? We hold, and it can be very taxing
Yeah.
sometimes. So it's good to notice it in your own self and noticing when to step away,
Yeah.
which it sounds like you have.
Yeah. Yeah.
Amazing. Thank you so much. I'm just going to do a quick recap of all the amazing things that you said. You started off by saying that you knew from very little that you were interested in medicine from your own personal experience of being in the hospital. You were pushed a little bit towards nursing because it didn't sound like in your family that they knew that medicine wasn't ready for someone with disabilities, at least openly. And so you
Yeah.
did go into nursing, but you learn that this is not where you're supposed to be. You were going to be a doctor. You withdrew and then went into your medical career, but that didn't mean you weren't going to have challenges. You pushed through it, but sometimes a little too hard. And but you recognize that in the long term of through reflection of just that holding that secret took a toll on your health. Eventually you were able to get through it, but it did impact your body that in residency you did have to take some more serious steps to address your health. You mentioned a surgery and having to be a little bit more aware of your body, and found that through your educational journey, you weren't really an advocate for yourself. You really had, thankfully, a strong advocate in your father, who was a physician, but it took time to develop that self advocacy in yourself. But by learning about other physicians who were starting to become more open with their personal experiences as patients, that's really where it's really helped you in your own journey of being an advocate and speaking up on your own experience to help your patients and really provide the care that they deserve. And I love that you've learned how powerful the voice is of a patient doctor and how lived experience can really bring that additional sparkle that only through lived experience you can have to really
Yeah.
understand. So I want to thank you, Dr. Church, so much
Thank
for
you.
sharing your journey and sharing your vulnerability because it resonated with me. So I can imagine that'll resonate with a lot of people who are trying to figure out their own journeys. Thank you so much for being here. And for the audience, I just want to say thank you for joining. And if this is your first episode, make sure you subscribe and follow. And I love to say to share it with at least one other person, because that's how we form community, is sharing the experiences. And that's how you can be an advocate yourself, is starting to share with other individuals. And I also want to remind everyone that that you're not alone in the experience. There are other individuals. I know that medicine can make us feel very alone, and that's why we're trying to share these stories, is to show that we're not alone, that the struggle is real, and but it will get better and there's meaning to it. So thank you, Dr. Church, so much. If
Thank you.
individuals would like to contact you, is there a specific area or thing that I can include?
You mean my email or what would
Whatever
email?
you would like.
Email's fine.
Wonderful. So I'll include the email below in the show notes, and I'll include all my social media is MedPsychMoss, and then also my website where I like to share resources. And I'll make sure to include Dr. Church's articles that she included. I have a section where I mention different articles and resources, including communities like Docs with Disabilities, like MSCDI, and there's a lot of others of to find that community and find that mentorship. So thank you, Dr. Sharp,
Awesome.
so much. And I
Thank
hope you all have a wonderful day.
Take care.